Hey there, it's Andre, the Impulsive Thinker. And today I have with me Dr. Kenny Handelman. He's the founder of CFMIH, Specialty ADHD Clinic. He's a psychiatrist for kids, teens, and adults, and is an expert in ADHD. He's also the author of Attention Difference Disorder and has taught doctors about ADHD in 22 countries across 4 continents. Kenny, thank you for joining me.
Thank you so much for having me.
Can you just give a quick blurb? Like, what is CFIMH?
Yeah, so the Center for Integrated Mental Health, we are a specialty ADHD clinic just outside Toronto in Oakville, Ontario. So we assess ADHD in kids, teens, and adults, help with treatment, therapy. I've got some other professionals there working. So really, we assess and treat ADHD and all the coexisting conditions that can come along with it.
Which is what we're going to talk about today.
Exactly.
And you've got experience in this because personally, you're ADHD yourself.
I am. And, I had the good fortune to train in Toronto in psychiatry, and I got to learn with probably one of the best Canadian ADHD researchers. So I got great training in ADHD. I loved working with people with ADHD. And then when I was 40, after having been a psychiatrist for 11 years, I found out I had it myself, which was an interesting little mind trick to realize that no wonder I get along with people with ADHD. I'm just a high functioning one, and we haven't really understood how many of us high functioning people have ADHD and haven't had it recognized. So
yeah, and that's one of the reasons I started the podcast, because there's not a lot out there for the high achieving entrepreneur or high achieving person or successful people, because we're not supposed to have it based on old thinking.
Yeah, and look, you and I can talk for hours. I'll just make this one quick point. In the diagnostic criteria, in the early days, it was like you need to have impairment. And a lot of doctors interpreted that impairment compared to the general public. Well, then if you are a highly successful person, business owner, university educated professional, you're higher than the average person. You can't have ADHD. But the real trick is, are you impaired compared to your abilities and your gifts? And, are there symptoms interfering with that? And that's where a lot of us higher IQ, high achieving individuals were not getting diagnosed.
Yeah, we're achieving goals that we're setting, and it's like it's just what they knew at the time. I'm not faulting for the past. It's just it's what they knew at the time, and for a while it was a kid's thing.
Absolutely.
So with my journey here, the one thing I've really come about is mental health. I'm really putting that forward and really discussing this. For October 2023 is ADHD Awareness Month, and I'm really working on talking about mental health and the coexisting conditions with ADHD. And you're here today to talk to us about bipolar disorder and ADHD. Yes. Do you mind starting off about what is bipolar disorder? Because I'll tell you, I've heard so many different versions, and everyone claims that they're bipolar in an anecdotal kind of way.
Right. So first of all, thank you for doing this. I think it's tremendously important. You're reaching many people who need to hear these messages, and I'm really honored you invited me to join. Research shows 85% of adults with ADHD have at least one other condition, and many have two or more. So having coexisting conditions is absolutely the rule, not the exception. So when somebody's getting a good ADHD assessment, you want to look for the ADHD and also if there's something else going on. Because if somebody has ADHD plus bipolar, it's very different management than if they have ADHD plus depression or ADHD plus anxiety, or substance use problems or trauma. So let's talk about bipolar. What is it? First of all, it's a mood disorder. Many people may recognize it by the older term of manic depression. And bipolar is the newer term, but manic depression helps to describe what's going on. So when somebody has bipolar disorder, they can have depressive episodes, so periods of weeks or months with low mood and all the criteria of a clinical depression, not just feeling sad a little bit, but low mood, lack of interest or pleasure, sleep troubles, appetite changes, suicidal thoughts, loss of hope, excessive guilt, etc., a full clinical depression. And the mood can flip upwards too, where there are manic episodes, which can be very intense with, 7 days or longer of elevated euphoric or irritable mood, decreased need for sleep. We're talking like usually 3 hours or fewer of sleep with tons of energy still going on, thinking a lot faster. Now, if you've got ADHD, we already think fast, but this is a whole new level.
Exponential now.
It's 1,000 miles an hour, not 100 miles an hour. talking too fast, so pressured speech, which can also happen with ADHD, but even more so. Increase in goal-directed behavior, sometimes good. I'm starting on new projects, I'm taking on new things, and it's great. Sometimes really chaotic and unproductive. Doing things that seem fun in the moment, but get you into a lot of trouble. So spending impulsively, sexual indiscretions. And it can get to the point where it's bad enough that people end up needing hospital care or actually hallucinating or having delusions, right? So I start to believe I am so great, the Lord is speaking to me and I will heal people with my hands, and I'm walking down the street to heal them, and I end up being picked up and taken to the hospital.
That's
right?
the manic side.
That's manic.
Wow.
So when people have a full manic episode, it is very noticeable to other people, and people say, what's going on? You've changed. It's important to note there's also something called a hypomanic episode. This is elevated, but not as bad, not as intense. So mania is a lot worse. It's much more severe and intense. But if you have a manic episode, you almost always end up getting help, right? Somebody says, something's going on here. We got to take you to the emergency department or get immediate help from your doctor or psychologist or whatever. But when there's hypomania, it's not as severe. So it's usually 4 days, 3-4 days, and the symptoms aren't as intense. So it may be that somebody's talking faster, thinking faster, not sleeping quite as much, starting more projects, and they seem a little chaotic for a few weeks or days, but it's not totally destructive of their life to the point that they end up having to go to the hospital or seek immediate care, but it is really undermining their relationships, their professional work, their business, or anything else.
Yeah.
And it can be more dangerous because they don't get picked up, right?
So it's the impairment to the daily functioning or daily relationships in the day.
Yes, exactly.
Day to day.
So now,
just before, go ahead. I got a question after that.
The one thing is, so the classic bipolar disorder, or bipolar 2, which is depression with hypomania, is periods of stable mood, then weeks or months of low depressed mood, then stable mood, then days or weeks of elevated mood, hypomanic or manic, then normal mood, etc. So people can go through clear mood episodes. So if it's sort of like, for 2-3 months, I'm pretty good. Then for a month or two, I'm really low. Then I'm high and I'm flying and I'm super productive. Think about bipolar disorder.
So we're not looking at day to day. We can go be manic one day, depressed the other, or stay, or I don't want to use the term stable, but level.
Yeah.
For that, you're talking about periods of time, days, weeks, months, and then a shift for days, weeks, months, and then another shift.
So this is the classic bipolar. The problem is not everybody, not everybody's brain or genetics follows the textbook, right? So there are more complicated bipolar where it's rapid cycling and it happens a lot more frequently, or it could be ultra rapid cycling or even almost switching moods within days or weeks, which makes it that much more confusing. And this is where we get a lot of overlap with ADHD.
Before we get into that one, you mentioned something when the manic is intense. So it can either be euphoric or irritable. When you said that, to me, it didn't make sense that irritability would be part of a manic episode if you're euphoric. Can you mind giving me a little more explanation?
Yeah, so I mean, I'm not just talking like your day-to-day frustrations. I'm talking irritable to the point of your spouse, who knows you get a little irritated sometimes, is like, what the heck happened to you? You were
right.
Your coworkers, your staff, your employees, your bosses, whatever it is, they are like, I don't know what the heck happened, because, something like a pencil being on the floor should not create an explosion here.
Right. Okay. Thanks for that clarification. So now you hinted at that bipolar is a lot of similarities with ADHD, but it is not ADHD. So what do you mean by that?
So first of all, people can have just bipolar disorder, people can just have ADHD, and people can have both. And
just to clarify, we're saying coexisting, but the other common term in the industry is comorbidities.
Yeah, comorbidity. The doctor term is comorbidity. It sounds a little more negative, so I usually say coexisting.
No, not like that. I just want to clear that for the listeners.
Yeah, so if you hear your doctor saying comorbid, he's talking about he or she is talking about a coexisting condition.
Yeah.
So there are some overlapping symptoms. So people with ADHD can be impulsive, hypertalkative. We can hyperfocus, right? And if you have a project you're super excited about, and there's a deadline and it matters to you and there's a lot on the line for it, you may lose sleep. You may put a ton of energy in it. You may be driven to do it. You may make some impulsive decisions, and that may look like a hypomanic episode. but it may purely be ADHD. And this is where hopefully you're talking to a doctor who has some experience with ADHD to distinguish between that's hyperfocus of ADHD with some impulsivity and some anxiety and stress. It is not a hypomanic episode. So it's really important to look at the sort of longitudinal history, the look back over time. Does this just happen during periods of big projects that are due? Or, you know, I've talked to people who are like, I really want to redo the basement. And then they'll be super hyper-focused for 5 days, staying up late, you know, really preoccupied with colors or design or some business project, but it's not really hypomania, it's hyper-focus. And then they're unproductive the rest of the time. The other thing is in the depressive episodes, you know, focus can be a lot worse, you know, things like that. So there can be overlap, and sleep disruption can be a problem in ADHD and mood disorders.
So focus and attention increases on the depressive side.
Yeah,
of the
and to
bipolar.
some degree with hypomania too. Yeah.
Right.
So,
oh yeah, good point.
Just to point out, if somebody has ADHD, like the general population risk of bipolar is about 3 to 4%. If somebody has ADHD, it's approximately 7 or 8% that have bipolar disorder. If we're talking everybody with a bipolar disorder, approximately 20% have ADHD. So about 1 in 5 adults with or people with bipolar disorder also have ADHD. And most psychiatrists diagnose the mood disorder, don't diagnose the ADHD. So, and you got to look for both too, right?
Yeah. You got to consider both.
Now, the other thing that's really important is the average age of diagnosis for bipolar disorder is about 25 years old. The most interesting thing about the course of bipolar disorder is there are studies where adults diagnosed with bipolar are asked, when did your mood difficulties start? And they don't say 25 years old. They say it was when I was 16, 15, like as an adolescent. And what happens is a lot of teens have, and I've worked in a general hospital seeing adolescents, a lot of teens have mood swings, depressive episodes, difficulties. And it's actually, it can be a bit of a hint toward bipolar disorder that's going to develop later. Now let's overlap ADHD. They may have school troubles, behavioral issues. They're depressed. They may be self-harming or feeling suicidal. Hopefully they're seeing a child psychiatrist who also assesses for ADHD, but it could also be the bipolar disorder that hasn't quite declared itself yet. And this is where it all gets tricky.
So would the teenage hormones kind of play in the fact that that might be overlooked?
Yeah. Hormones also contribute to impulsivity and bad judgment, let's be honest.
So with I was listening as a conference, and what really hit me, because I started to talk about how I think ADHD, we have more, ADHD brings you to get in more depressive waves, not necessarily depression, but just we get in these low moods. And what struck me is this presenter said the difference between bipolar depression and ADHD depressive state, or actually, let me start over. She said bipolar, the big difference between depression and bipolar depressive state is they're not triggered. And I had Chuck Englefield on here talk about his depression experience. And he says the mood chooses you, you don't choose the mood. And I started to think about that. So every time I get into a depressive wave mood, I can always go back to a trigger that upset me. And then my emotions just kind of, I'm down for a while and I can get myself out. Like, is bipolar, is it triggerable? Is there a separation between the two?
Yeah. I mean, I think excellent point. This is a really sort of expert sort of level question. This is where, like, when somebody has a true mood disorder, the more severe it is, the more likely the mood is just to drop with no trigger and drop quickly. If you have a more mild mood disorder, whether it's depression or depression in the context of bipolar disorder, it could be a life stress, change in work, change in relationship, financial stress, and you start to feel like sleep troubles, worry, guilt, stress, etc. And then you slowly fall into a depression. But if nothing's happened and you drop quickly, it's an indication of a more severe mood disorder, and it's certainly more concerning for sure.
Yeah, I've had some family members mention they're not my direct family, but they've got family in their family that has bipolar, and it says it's night and day. Like, it's not the same person. So when you were talking about that earlier, it's like, it's not the same person. What I heard, that you start to wonder who the hell this person is, because that's not my usual
Yeah,
person.
I mean, maybe it's not the best reference, but Dr. Jekyll and Mr. Hyde, like, you've changed. What's going on this week, right?
And it's noticeable. That's the point I guess I'm trying to make. It's a
Well, yeah.
noticeable change. That's not you extra excited or extra sad. It's like a kind of, whoa, who is
Well,
this
and
person?
you're absolutely right. One of the diagnostic criteria is the mood changes are observable to others. So it's not just, I feel like I'm not sleeping as much and my behavior's changed. My spouse, my partner, my kids, my coworkers are saying something's up with you, right?
Mm-hmm.
Can I just mention about ADHD with depression?
Yeah, go ahead.
Sometimes there's demoralization with ADHD, right? Like, we can end up, we're not functioning as well as we can. We know we shouldn't have messed up. We had a goal we wanted to do, but didn't meet our deadlines or whatever. It can make us feel a bit lower, but that's not always a clinical depression, right? Though of course it can contribute to it.
And is there a difference, women versus men with bipolar? Like, is one more diagnosed or undiagnosed than the other with combination ADHD? I got a sense there's a difference between men and women.
Yeah, I mean, I think if somebody's got a full-blown true bipolar disorder with clear manic episodes or hypomanic episodes, clear depressive episodes, I'm hoping they're getting the proper diagnosis, and I think they do. Women with ADHD who can be impulsive, or may, there are societal expectations. If a woman is sleeping around more, like, that's still unfortunately viewed very negatively compared to a man. And women can be considered, look, you sound hypomanic. I had a patient years ago who, she worked at some corporation in downtown Toronto. She'd get bored with her meetings. She'd go off and start shopping. She had some sexual relationships with people, and they diagnosed her with bipolar disorder. I went through her history, and she truly just had impulsivity of ADHD. There were no clear episodes. So sometimes the symptoms can be misinterpreted, and it can be harder on women for sure.
And I think that's also a really good point to remind the listeners here is, because I'm helping a couple of entrepreneurs here. One is she a female, and she is hyperactive, which is also, I don't think it's as rare as people think they are. It just was never seen as a not acceptable, but just didn't think that women would be hyperactive, but highly impulsive. And that is overseen or misunderstood by a lot of people. Just because they're impulsive doesn't mean they're doing anything wrong. It's definitely a big factor that's overlooked in women diagnosis, in my opinion, from what my limited knowledge I've had.
I agree with you. Can I just comment quickly about treatment if you have ADHD?
No, I do want to talk about treatment. We got a few more minutes here. Go ahead.
Okay,
Thank you
good.
for.
Yeah, so I mean, look, every treatment for ADHD should include education, which is why I'm thrilled to be here, therapy and strategies, ideally with a professional. Some people do the self-help books and workbooks, which can really help too, if we follow up with them, with which many of us with ADHD don't.
Yep.
But medication, ADHD medicine can be tremendously helpful. The problem is, if somebody has bipolar disorder and they take an ADHD medicine or an antidepressant that helps with depression or anxiety, there's a risk that it will trigger a lot more mood swings. So you could have more, it can push somebody right up into hypomania mania, and it can cause rapid mood swings from high to low. So if you take an ADHD medicine, you have some mood symptoms, you're not sure about this, but you take an ADHD medicine, all of a sudden your mood is swinging all over the map. You got to talk to your doctor about this.
Also can actually aggravate the symptoms of bipolar, even though we're helping the other ones.
I think of it as like, sort of a sailboat without a rudder. Like the rudder helps keep the boat go forward when the wind hits the sails. If there's no rudder, the boat can float, sideways, right? And that's what can happen when a medicine is taken and there's no mood stability. What needs to happen if somebody has bipolar disorder is you got to take a medicine that helps to stabilize the mood. A mood stabilizing medicine helps to control the elevated moods, hypomania, mania, stop them from happening. It helps to treat the depressive moods, the lows from happening, and it helps to keep people steady going forward. Not every medicine is perfect at all three jobs. There are different ones, and you have to work through and find the right one for you. They can have side effects. They can be a little more tricky than some of the other medicines, but there are really good and new options. So you've got to get on a mood stabilizer that keeps you steady, which will help day-to-day functioning and life and relationships and everything else. And then it's okay to take an ADHD medicine because you've got a rudder on the ship. Your mood isn't going to swing too high, too low if you take an ADHD medicine because the mood stabilizer is there. Plus, you're also monitoring it and your doctor's monitoring it, etc.
Yeah, and that's one thing I really learned with time, is just to be completely honest with your medical practitioner, no matter how many you have, including therapists or whatnot.
Yeah.
And, but you have to be open and honest with yourself to observe these and be open to these observation.
Well, and I think this is why education is so important. And I'm so glad you're doing this, because so many of us, we grow up with family and society that says, just try harder. This is all fine. There's limited understanding of, mental health issues. So we grow up thinking that's just normal that I do this. And I don't think I really have a problem. I'm not sort of a quote mental case or something.
Yeah.
When in reality, you may have symptoms that are impairing, and you need to be honest with yourself, as you said, and realize I actually need some help here, and I got to monitor this, and I'm not totally okay, right? I've got some challenges.
Yeah. And that's one thing you did not say today, Kenny, was that bipolar is a problem. It's just a condition to treat. And there's, like with us, ADHD, we have it. What are you going to do? Bipolar is a mental health condition. There's nothing. It's not because of you. It's not a fault of you that I don't think you can create bipolar, I'm assuming.
No.
So it's a condition that you may have, and let's get the treatment for it, and
Absolutely.
not to be ashamed by it. And I remember as a kid, some people say, oh, they got bipolar, and we treat them like crazies. And that's not what we're saying here. You did not even hint at that. So I got a lot of respect for that, because it's just, let's take care of mental health, because then our physical health will take care of itself afterwards, is what I see.
I often think, it's the challenging thing with ADHD and specifically, and mental health in general. If a woman has a breast lump, God forbid, she goes to the doctor and the doctor helps out. She doesn't have to try and convince her doctor that breast lumps are a real concern, and she read some articles saying it should be investigated this way or treated that way. She goes in and says, please help me. I think I have a health concern here. And the doctor helps. With ADHD, with other mental health conditions, we often have to go to the doctor and advocate and educate and come in with research. And some of it on the internet is amazing, and some of it, not so much.
Not so much, right? Yeah.
So I'm glad, to help your listeners.
Well, and that's the thing is I want to give people the tools to advocate for themselves and have a real conversation. Just don't say you learn on TikTok, I have it, but to go with the information and research. And I do find a lot of medical professionals do like you show up prepared.
Yeah. Right. Well, I think it depends on year of graduation in medical school. Somebody's been a doctor.
Fair enough.
It's the paternalistic model, but doctors with good confidence and good training are very open to hearing what people have learned and what your opinions are, right?
Yeah. So, man, we learned a lot here. I learned a lot of new things. And I think you made a really good statement at the beginning, is that the impairment is compared, at first impairments was always compared to the general public, but we should be looking at the impairment compared to our own abilities, be it ADHD or bipolar or any other mental health conditions. Or even any cognitive type of testing. What is my ability? Measure me from being able to climb the tree, not to swim in the water, right?
Exactly.
Disorder, manic depressive. You got your manic states, intensive euphoric or irritability, and then your depressive mood swings are down. And the one thing that really got me was the period of time these moods, they can't be mood swings, mood periods, as you call them, could be days, weeks, months. And that was a big shift for me in the thinking. And I never realized you can have that hypomania, so it's less severe. And that is a little more of a subtle difference. Is that a good assumption to make?
Yeah. Yeah. But that's why it can almost be harder, because people don't recognize and go longer without getting help.
Yeah. And like you said, mood changes are observable by others is one of the key factors. And I just want to point this out. Usually I keep it to 3, but I'm going to do a 4th one here. And in women are diagnosed with bipolar more, but it's actually a lot of times impulsive ADHD. So they keep them, or it can be, but to keep that in mind for the women out there. So, so in the end, bipolar disorder is a mood disorder. Has similar symptoms for ADHD. And for you, the listener, have you observed or analyzed your mood changes and understand, is there a trigger, or there's just don't understand why? So let me know what you think about this episode. You can email me at andre@tacticalbts.com. Any final words, Kenny?
So maybe I'm opening up on another whole can of worms, but if so, you can just bring me back. Emotion dysregulation of sort of mood swings with ADHD can happen for a lot of people, and this is not necessarily bipolar, right? It's not clear episodes. Well, that may be a much bigger topic for another day.
No, but it's a good one, because I talk a lot about emotional dysregulation, and that is definitely something we got to keep in mind for it. And where can we find your book?
Oh, it's on Amazon. It can be ordered in bookstores. Attention Difference Disorder. It's a book for parents of kids and teens with ADHD.
And I'm going to have your website and a link to your book in the show notes, so make it easy for everyone to find. And please, really good book. And thank you, Kenny, for coming once again.
Thank you so much.
This is the first time. We're coming back, though. I know we got a few more topics we want to talk. So thank you for sharing your knowledge today.
Thank you so much.